Signs that your toddler needs further testing for autism. Hi, I'm Carrie. I'm a pediatric speech language pathologist, and I get asked this question time and time again on social media. Okay, does your toddler have a speech and language delay? Yes, a child can have a speech and language delay without having autism. However, we do notice that lots of children who are autistic will have a speech and language delay. Next thing I'm looking at is how your child plays with toy. Does your child take a car and spin the wheels? Does your child like to figure out how an object is used? Does your child functionally play with toys? And again, does your child always go back to that same toy? So a child might sit there and play with the toy for a while, and it might not look like a functional playing of the toy, and then continue to do the same thing. Things that I see kiddos do would be to flap toys, to look at the wheels on a cart, or to line things up. Next thing I'm looking for is how a child communicates with his or her caregiver. Is the child pulling the hand to the object that he or she wants, or is the child looking at the caregiver as an entire entity and trying to communicate that the child wants more of a desired object? Another thing I look for is how the child perceives the environment around him or her. For instance, is the child sensitive to loud noises? Does the child have an extreme fear? Does the child lack a fear of jumping off a couch or bouncing through things? Those can be signs of autism. How does the child feel about certain textures of clothing, certain textures of food? Is the child really sensitive and really particular to different textures? Another thing I look for is when the child does start to develop language or starts to speak and talk, how is the child communicating? Is the child repeating songs that he or she has heard in the past? Is the child using single words, or is the child using larger chunks of language? Another thing we like to call that is echolalia. Do you sometimes feel like your child has difficulty hearing you and has lots of difficulty following single step directions? That's another thing that I look out for as well. If your child is exhibiting lots of the characteristics that I just listed, I would recommend getting your child tested for autism. Remember, getting an autism diagnosis is not a bad thing. It helps caregivers, it helps therapists, it helps teachers, it helps your child succeed and be the best version of him or herself, and you are not alone.